Hello, and welcome to Rise Unwind. We're that show where we talk to people from across the country about things you could do in your neighborhood. And on this week's show, we got this.
So patients end up in this endless loop of surgery and recurrence, just to try to maintain their voice or breathing.
And we surveyed over 1,000 service members, both active duty and veterans, and we wanted to learn more about their knowledge and their opinions of VA home runs.
Screening is a really important first step. Screening can lead to diagnosis of prostate cancer, and the earlier this disease is diagnosed, the better the treatment outcome.
Look and review your healthcare expenses from the prior year. Think about your budget. Think about your health needs in the coming year.
All of that and more right here on Rise Unwind. Most people have never heard of recurrent respiratory papillomatosis, or RRP. But for those that are living with it, it can mean surgery after surgery just to keep their airways open or to speak normally. Now, for the first time, the FDA has approved a non-surgical treatment, giving new hope to adults that are battling this rare HPV-related disease. So joining us are Dr. Simon Best from Hopkins School of Medicine and Michael State, a patient who participated in the clinical trial. Welcome to the show, you two. How are you?
Doing well.
Very good, thank you.
All right, Dr. Best, you got to let me know, what exactly is RRP and how does it affect patients?
Well, thank you. And we're really excited to be here on behalf of Precigen to be able to talk about recurrent respiratory papillomatosis, or RRP, as you said. It's an HPV-associated disease. It's caused by the HPV type 6 and 11, which infect the vocal cords and cause papillomas to grow on them, preventing the vocal cords from vibrating to make sound. Historically, the only way to manage this disease was with surgery. So we take patients to the operating room with lasers or other instruments, remove the papilloma. But because you haven't addressed the underlying infection, these papillomas would recur. So patients end up in this endless loop of surgery and recurrence, just to try to maintain their voice or breathing.
And Michael, can you tell us about your personal experience living with RRP and some of the challenges that it has brought into your life?
So through the course of RRP, I've endured over 50 surgeries. I've lost count, but over 50. And of course, there's the physical toll of those surgeries. But professionally, I'm a dentist by training. And as my voice failed, I had a very difficult time speaking to patients. My assistant would have to do most of the talking towards the end of the appointments because I just didn't have it in me to talk anymore. On a personal note, it became very difficult as my voice went down to just a whisper to talk to people in social situations, family, neighbors, friends. And I started avoiding them. It was too difficult for me to try to project, and it was very awkward for those I was trying to talk to who couldn't hear me. So I just basically.
And Dr. Best, how does this new treatment work when compared to repeated surgeries patients have faced over the years?
Well, Pabzimios is an immunotherapy for adults with RRP. And what it's designed to do is help raise a specific immune response against the HPV virus, similar a series of shots, in just like getting a flu shot or a COVID vaccine, that generates this specific immune response that can then circulate throughout the entire body and find those HPV-infected cells wherever they occur in the vocal cords. And so it can help actually address the underlying cause of RRP, address the underlying HPV infection, rather than surgery, which is just debulking the papillomas.
And Michael, you're the guy that's gone through it. What does it mean to you to be personally part of this clinical trial and see the treatment approved?
I'm beyond grateful that I was able to participate. There is a slight side effect from the shots. It's sort of a 24-hour flu-ish type thing, much like when you get a flu shot or a COVID shot. But compared to the repetitive surgeries, it's just amazing. My voice is back; it's strong, and I'm very proud to have participated in the trial and in my small way contribute to the science for thousands of people out there with RRP to know that now there's hope beyond just surgery after surgery after surgery.
And for anyone who wants to learn more, where could they go for more information or maybe some support?
Well, there's great information about recurrent respiratory papillomatosis and Papzimios, the new treatment, on the Precigen website, which is precigen.com.
I want to thank you too for joining me today.
Thank you.
Thank you.
Did you know more than 40% of military families have had a mortgage never used a VA loan? A new survey from Navy Federal Credit Union found that even though awareness is high, a lot of misconceptions will stop service members and veterans from using this key benefit. So joining us today is Chris Davis, Assistant Vice President of Residential Lending with Navy Federal Credit Union, to help clear up some of that confusion and share how military families can make the most of their home buying options. Welcome to the show, Chris. How are you, my friend?
I'm doing quite well. Thank you. Thank you for having me on the show.
Your recent survey looked at VA loan knowledge among service members and veterans. What do you think stood out to you most from some of these findings?
Yeah, so Navy Federal Credit Union just came out with this new report. We've entitled it Spotlight on VA Loans. And we surveyed over 1,000 service members, both active duty and veterans. And we wanted to learn more about their knowledge and their opinions of VA home loans. As you said, we found out that more than 40% of those from the survey that had a mortgage didn't use their VA home loan benefit. We found that the general awareness of the program is high. Our survey found 92% were aware of the program, but many held misconceptions about the benefits and the features of the VA home loan. And on average, 2 to 3 critical misconceptions that may be preventing them from taking full advantage of this benefit.
So what are some of the biggest misconceptions keeping military families from using VA loans?
Yes, misconceptions around the down payment are common. A large down payment can be a big barrier to purchasing and home ownership, but VA loans do not require a down payment. 2/3 of our respondents in the survey believe a down payment is required. Also, few from the military community seek information from their lender. And we know that it's important for them to work with a lender that specializes in serving the military community, one like Navy Federal. And then further, realtors working with the active duty and veterans need to have a strong understanding of the VA home loan program. And they need to have a strong understanding of military buyers' unique needs.
And for those that are currently looking to buy or maybe even refinance, what tips do you have to help them take full advantage of their VA loan benefits?
Well, the VA mortgage loan is designed to make home ownership more attainable. The interest rates are lower. The underwriting is more flexible, easier to get approved. As you said, VA loans also offer a streamlined refinance. So once you have a VA loan, you'll be able to refinance it using the streamlined refinance that has reduced documentation and reduced closing costs. We also offer free specialized training to real estate agents, including realtor continuing education. And then we connect our buyers to trained agents through our Realty Plus program.
And finally, where can our viewers go to learn more?
If you want to learn more about VA loans, visit any of our branches or call our toll-free contact center anytime. And everyone can get online, use our tremendous tools and resources that are available at NavyFederal.org.
Chris Davis, I want to thank you for joining us today.
Thank you.
Prostate cancer doesn't just affect patients, it impacts entire families. A new study shows caregivers are often the driving force behind screenings, treatment decisions, and day-to-day care. So joining me today is Dr. Daniel George, medical oncologist and professor at Duke University, and Gina Carithers, president and CEO of the Prostate Cancer Foundation, talk about how caregiving and treatment have evolved for prostate cancer patients. Great to have you both here. How are you?
Thanks, Dan. Happy to be here.
Great to be here, Dan. Thanks.
All right, Dr. George, let's start with you. Who's most at risk when it comes to prostate cancer, and how should men know about early detection?
Yeah, Dan, the truth is all men are at risk for prostate cancer as they age, but 3 groups in particular. People with a family history of prostate cancer are at greater risk of developing it themselves. Black men or men of African ancestry are at increased risk of prostate cancer and aggressive forms of prostate cancer. And lastly, we recommend a PSA test. This is a simple blood test your primary care doctor can draw somewhere between age 45 and 50. And if that level is above 1.6, that's a flag for us. You're at increased risk of developing prostate cancer. So those 3 groups we like to focus on.
And Gina, caregivers often carry a heavy emotional and physical load. What are some of the best ways they can support loved ones through this process?
Yes, Dan. And the role of the caregiver is really vital for the patient in this process. So, as Dr. George mentioned, screening is a really important first step. Screening can lead to diagnosis of prostate cancer, and the earlier this disease is diagnosed, the better the treatment outcomes. We see a 99% cure in men that are diagnosed and treated early. The caregiver and the family members are a large part of encouraging the men in their lives to be screened continually after the age of about 45 if they're at elevated risk, and 50 if they're at normal or average risk of this disease. And the caregivers are the ones who then also support the men through once there is a diagnosis of prostate cancer. If this is diagnosed as localized disease, they're a part of the medical appointments, they're a part of helping the patient deal with all of the decision-making that goes along with treatments. And if, in fact, the patient is diagnosed with advanced disease or a disease that is outside of the region of the prostate, maybe now in the bones or other body tissues, then that is a longer process, and that caregiver is going to provide knowledge and information and resources to that patient that support them through the journey, including attending the doctor appointments and helping to translate some of the decisions that they as a family or as friends make for that male along this journey.
And Dr. George, the treatment landscape keeps changing. What advancements stand out to you right now?
It sure has, Dan. The truth is that, 10 years ago, men with advanced stage, cancer that spread to other parts of the body, prostate cancer, that average survival was maybe 2 or 3 years. Now it's 7 to 10 years. And what's changed is combination therapies, not just using hormonal therapies, but combinations of hormonal therapy, chemotherapies, or even other targeted approaches. And, it's important for people to understand what their options are, what's out there and evolving. And we have a new website for this. It's called Advanced PC Treatment, all one word, advancedpctreatment.com. And I'd encourage patients to check it out. It's staying informed is a big part of survivorship, and in sources like this can be credible resources for you.
And Gina, how can patients and caregivers find reliable support or resources when they need them the most?
Yes, Dan. So the Prostate Cancer Foundation launched a new website that provides everything from the treatment pathway, from diagnosis, staging, throughout what might ever be the individual patient journey. We also, at the Prostate Cancer website, we hold webinars for patients, and we offer those on our website as well when they're not attended live. So pcf.org is full of resources. And then, as Dr. George mentioned, advancedpctreatment.com is an exceptional site, also patient-facing, that supports the patients in their treatment decisions also along this journey for them and their caregivers.
I want to thank you, too, for joining me this morning.
Happy to be here. Thanks for having us, Dan.
Thank you, Dan.
Choosing the right health coverage can get confusing, especially when it comes to Medicare. And right now, millions of Americans are making those decisions during the annual enrollment period. Joining me today is Jeremy Gaskill, Regional Medicare President with Humana, to help break down what people should know, how Medicare Advantage works, and how it can help you stay on top of your health. Welcome to the show, Jeremy. How are you?
I'm doing great. Thanks for having me.
Okay, this is a busy time for anyone with Medicare. Why is the annual enrollment period so important?
Yeah, because that annual enrollment period is happening right now. It began on October 15th and it ends on December 7th. And so this is the time of year when beneficiaries can review their current plan, they can make changes to it, and they can just enroll in Medicare Advantage plans. It's also the time of year when they can enroll in prescription drug plans. And all of this takes effect January 1st of 2026.
And you mentioned Medicare Advantage and Original Medicare. Can you walk us through the main differences between the two?
Yeah, Original Medicare is a federally managed health plan. Now, this covers your hospital stays, it covers your doctor visits, but there is a deductible associated with that. And so essentially, members will be responsible for about 20% of the total cost. It is important to point out that if you want prescription drug coverage, you need to purchase separately a prescription drug plan. Now, Medicare Advantage those are administered by private insurers like Humana. So in addition to your hospital stays, your emergency room stays, your doctor visits, there can be coverage for other benefits. It just depends on where you live. One of the most important things with Medicare Advantage is that there's a yearly out-of-pocket maximum. So you know what the most is that you could spend in a given year.
And when comparing Medicare Advantage plans, what should people really be thinking about before they choose?
Yeah, I would say cost and coverage. We encourage everyone to take a moment, step back, review the current plan that they're on. And even if they really like the current plan that they're on, understand if there's going to be any changes to it in the coming year, because there can be changes every single year. When it comes to cost, look and review your healthcare expenses from the prior year. Think about your budget. Think about your health needs in the coming year. Compare premiums, deductibles, out-of-pocket maximums when determining what is the right plan for you. And when it comes to coverage, remember that Medicare Advantage plans have networks. So ensure that your doctor and your preferred hospital is in network. And if you're looking at a Medicare Advantage plan with a prescription drug benefit, make a list of your medications, ensure that they're covered, and understand if there's any additional costs associated with any of those medications.
So how do Medicare Advantage plans help support things like preventative care and maybe those regular checkups?
Yeah, Medicare Advantage, they really emphasize preventive care and care coordination. Your Medicare Advantage plan can include coverage for your annual routine physicals, your annual screenings, your management of your chronic conditions. All of this just ensures that you stay healthy and we have early detection, which just leads to better health outcomes. So when comparing a plan, make sure you understand what is covered with regards to preventive care, with regards to screenings, and make sure you understand if there's any additional cost.
And for those who need help understanding their options or maybe even getting enrolled, where can they go for guidance?
You know, Medicare.gov is a great place to start. They have a really neat tool where you can compare plans side by side. There's also a number of professional licensed sales agents that can sit down with you and help you review the plans and pick the right one for you. And if you're interested in specifics about Humana, Humana.com is a great resource.
Hey, I want to thank you for joining me this morning.
Thanks for having me.
The holidays are here, which means travel, parties, and a whole lot of stress on our bodies. Between late nights, big meals, and cold weather, it's easy to forget about our health this time of year. So joining us with some smart ways to stay healthy through the holidays is Dr. David Fairchild, Chief Medical Officer at CVS Health. Welcome to the show, Dr. Fairchild. How are you?
I'm doing well, Dan. Thanks for having me on.
All right, with so many people hitting the road or flying this season, what's your best advice for staying healthy while we travel?
Well, nobody anticipates that they're going to get sick when they travel, but we all know it happens. So the best thing to do is do what you can to prevent getting sick, and if you do, be ready for it. So think about the prescription medications that you have. Make sure that you've got enough to cover you during the trip, maybe a little bit of extra. And if you need to, get those refills done before you leave. If you can, get vaccines for the common viruses that are circulating. Flu is around, COVID is around. The flu vaccine is still available. It's still not too late to get the flu vaccine this fall. And the COVID vaccine is available. I got both of mine a couple of weeks ago. The other thing I do to anticipate, being ready when inevitably somebody gets sick in the family, I have a travel kit with over-the-counter medicines. So if somebody has a fever, develops diarrhea, what have you, I've got medicines at the ready to help treat that. And then as a primary care doctor for many years, I know that people can have complicated medical issues. And if you're one of those people, it's a good idea to check with your doctor and make sure that you're doing everything you can to travel safely during the holidays.
And once we're surrounded by family, food, and festivities, what are some easy ways to keep our immune systems strong?
Yeah, it's a great question, and it's so important to try to stay healthy during the holidays. It's challenging, right? We're not getting enough sleep, et cetera, but try to get as much sleep as you can. You know, we all need 8 hours, and you can't always get that, but do the best you can. In terms of eating, nutrition, as we know, is so important. I, for one, I'm going to sign up for ice cream and apple pie when it comes my way, but getting plenty of Fruits and vegetables as well, keeping it well balanced even during the holidays is a great way to stay healthy. But probably most importantly, it's important to get outside, get some exercise, move your body in some way. You can't watch football on the couch all day. Go for a walk, go for a jog, whatever is available to you. It's a great way to reduce stress, both being outside and getting exercise. Those are both really good ways to stay grounded and stay healthy, even when things can be stressful.
And if someone does get sick while traveling or visiting family, what is the best way to find quick, reliable care nearby?
Well, inevitably, if we do get sick, isn't it true, Dan, that it's always inconvenient, right? It's a Sunday afternoon when we don't have easy access to our regular health care. Well, mini clinics, the clinics that are inside some CVS locations, are available 7 days a week. We have evening hours and we have Saturday and Sunday hours. So pretty much whenever you have a medical issue come up and you're away from home, hopefully there's a mini clinic that's close to you. We also have virtual visits that are available 24/7 in all 50 states. So even if there's not a clinic close to you, you can get on the CVS Health app and schedule an appointment with a nurse practitioner or a physician associate virtually, and they can give you treatment for flu or COVID or whatever might be coming up.
And the holidays could also be tough emotionally. What can people do to protect their mental and emotional health this season?
Yeah, it's so true. The holidays are definitely a stressful time for many people. I encourage people to focus on self-care. Think about what will help you stay grounded and healthy during the holidays. We mentioned getting outside and staying active and eating right and getting sleep. But if somebody does feel really sad and down, MinuteClinic has mental health services that are available virtually in 49 states for people who are age 13 and older. We've got mental health counselors that can help get people through whatever they're feeling, whether they're feeling down, depressed, anxious, what have you. So it's a great way to, no matter where you are, no matter what's coming up between physical health and mental health, there's a way through the MinuteClinic app to get access to services. And then the other thing that I think about is loneliness can be a problem during the holidays for many people. Even for my wife and I, we're a blended family. Our kids are often with their other parents on Thanksgiving, for example. So we've taken to volunteering on those days, and it's a great way for us to be around other people and stay connected. I encourage people who anticipate being alone during the holidays to plan to be with a community group or a church group that might be having a gathering, or do some volunteering yourself. It's a great way to stay connected to people.
And before we wrap up, where can people go find more information or access local care options?
People can go to MinuteClinic.com, that's on the web, or they can download the MinuteClinic Health app, which is a great app that has access to locations of CVS pharmacies and CVS MinuteClinics, but you can also schedule an appointment virtually for mental health or physical health services.
Dr. Fairchild, I want to thank you for joining me today.
Thank you, Dan. Thanks for having me on.
Thanksgiving is supposed to be about family and food, but somehow it always turns into chaos in the kitchen. Luckily, Amazon has some smart ways to simplify your feast. So joining us today is Griffin Buck, Amazon spokesperson and a guy who knows how to make holiday prep a whole lot easier. Hey, Griffin.
Thanks so much, Dan. I'm good. Thank you for having me.
All right, we got to start with the budget. How can families keep costs down without cutting corners on that Thanksgiving meal?
Customers can feed 5 for just $25 when they shop Amazon's Thanksgiving meal deal from November 12th through November 27th. And it's one of the best deals around. The meal includes all the essentials like a butterball turkey for just 69 cents per pound, pre-made sides like home-style stuffing, mashed potatoes, and traditional fixings like gravy, green bean casserole, cranberry relish, crescent rolls, and of course, you can't forget the pie, the perfect thing to wrap up every meal. And we know many folks will be traveling for the holidays, which is why the savings go beyond the kitchen. Every Friday through the end of the year, Prime members save 25 cents per gallon at participating BP, Amoco, and AMPM locations nationwide. That's more than double the everyday Prime savings, just as millions get ready to hit the road for their Thanksgiving celebrations.
All right, what are some ways we can make prep time a little easier so we can actually enjoy the day instead of spending it all day in the kitchen?
Yeah, I'd say shop strategically. Take advantage of pre-made sides that deliver convenience and value without sacrificing quality, like our home-style stuffing, mashed potatoes, macaroni and cheese is also another great idea. Items that don't take too much time or multiple cooking appliances, so you can get back to spending time with your family. But if you prefer to craft your own recipes, maybe you've got a homemade recipe that's been passed down from generation to generation, it's easy to shop for grocery essentials on Amazon too, like whole carrots, Amazon grocery gold potatoes, and cut green beans.
All right, what are some of your best tips for a smooth, stress-free meal?
Yeah, keep your stress levels low and your oven free by maybe starting with a no-cook appetizer, like our charcuterie board right over here, made with premium meats, cheeses, a variety of crackers, fruits, and even some store-bought dips. You can elevate a nice charcuterie board with maybe some fresh herbs, and your guests will have something delicious to enjoy while you focus on the main event, and that's probably going to be the turkey. Now, you can't forget about dessert, too. Everyone's got their favorite flavors, and it's hard to choose just one. That's why we've got a variety of pies available under $7, including pumpkin, pecan, sweet potato, cherry, berry, and apple pie. And if you want to elevate that pie table even more, maybe add in some fun toppings for your guests to check out. Now, ice cream and whipped cream, those are classics. You can't go wrong, but maybe add in some other fun, exciting ones too, like hazelnut spread on top of your pumpkin pie, or my personal favorite, which is salted caramel on top of your apple pie. It's a great way to get people excited about dessert.
And if we realize halfway through the meal we forgot something, what is the easiest way to get what we need without all of the hassle?
Well, I think it's important to get ahead of the holiday rush. There's nothing worse than having to run out and get items at the last minute. So I would suggest maybe try shopping online. There's nothing more convenient than getting your groceries delivered straight to your door, whether it's with Amazon's same-day delivery of perishable items or everyday hosting essentials that you might need for the holidays, Amazon Fresh, or Whole Foods Market. It's also important to remember that you can delegate and share. There's no reason that you need to do every single thing yourself, and the best holiday meals are actually when everyone contributes a little bit. Maybe ask your guests to bring their favorite appetizer, side dish, or dessert, and you can stay focused on the main dishes and actually enjoy your own party.
And where can people go to get started with this year's Thanksgiving planning and deals?
Absolutely. Customers can go to amazon.com/grocery to start building their holiday baskets and explore our wide selection of grocery items and everyday low prices. We're here to make the holidays stress-free and easy for everyone so they can spend more time with their families.
Griffin Buck, I want to thank you for joining me today.
Thank you so much for having me.
And that is it for Rise Unwind. I want to thank you for tuning in and checking out the show. If you actually want to be on this show, all you got to do is go to our website. That's riseunwindtv.com. Fill out the form, send it on in, and maybe you could be on a future episode. Hey, we're on social media. You can check out all the behind-the-scenes stuff, like the cats. Just follow us on Facebook and on Instagram, or go to our YouTube channel. That's @Rise Unwind. And make sure you like, comment, I don't know, share it, tell your friends, I don't know. Click the bell icon so you can be notified on future episodes. And until next week, that was the show we like to call Rise and Unwind. Remember, have yourself a quality day. And remember, quality isn't spelled with a K. See you next week. That's all I got.